Hi, my name is Melissa. I'm in Adult Health 1 at Spain University. This video is about the major eye structures, their functions, and also three different diseases that adults and older patients go through and the nursing interventions and treatments for them. First, let's start with the retina. The retina is the one layer inside the eye responsible for detecting light and then sends signals to the brain so we can see. Then the conjunctiva is a membrane that lines the eyelid and the loops back to cover the sclera. The cornea, right here, you can see cornea. It's a protective outer layer and protects us from dust, germs, anything that can create damage to the eyes. The iris right here is the color part of the eye, and muscles in the iris control the pupils. Let's see here. The pupil right here. The pupil of the eye is the black circle that we have, and in the center, and the structure is unique to each person. Also, we have the sclera. Let's see where I can find it. Sclera right here, and the sclera is main function is supporting the wall of the eyeball and helps maintain the eyeball shape. And protects from injury too. The sclera, also the lenses is like our camera. Lenses of the eye is like our camera because it's the one that help us focusing objects. And it's also called crystalline lens. They're also called like that. The optic nerve right here transmits visual information from the retina to the brain. Let's see other areas here. And those are like the major structures that is important to know about the eye and how they function. Here. The three most common eye illnesses that older patients and adults suffer from are cataracts, glaucoma, and then also macular degeneration. Macular degeneration is an eye disease that blurs and decreases the central vision. And then, unfortunately, for that is not a cure. It's just make it manageable and reduce the process of the illness. Some of the symptoms are that they need brighter light to be able to see properly, increased difficulty adapting to low light levels, decreased also creates like central vision issues. Some of the treatments that doctors take, or steps that doctors take, physicians, for this disease is, since it's not a cure, to slow the process, is to take, for patients to take anti-angiogenic drugs, some laser therapy, some photodynamic laser therapy too, and some like low vision aids like wearing glasses. The nurse also cataracts. So cataracts is a cloudy area in the lens of the eye and are very common. Almost 80 Americans the age of 80 or older had surgery, like about have surgery to remove them. So the good news about cataracts, if it's any good news about it, is that it's very common, and and is treatable, and you can get surgery and take care of that. Some of the treatments early on is use bright lights when you do homework or are working, wear anti-glare sunglasses, use magnifying lenses for reading and other activities. And as I said before, surgery is suggested. Then the other disease is glaucoma. Glaucoma is a group of eye disease that tends to do vision loss and blindness by the damage of the nerve in the back of our eye, in the optic nerve. And some therapies or treatments for these are laser therapy, drainage tubes sometimes, also surgery. And then for the nursing interventions for almost all of them, it's important to assess the patient first and see, after diagnosis, and see what stage are they, how bad is their vision, and then provide education about how to make changes with the daily life with their reduced vision to make sure that they are safe. Encourage patients to check with their ophthalmologists like every 6 months to a year. Educate patients about having good lighting wherever they are in their house. Also to be careful with pets and rocks if they don't have central vision or proper vision, so they can trip and fall, especially for patients that are geriatric, because falls can create a lot of issues after this age. It's important also to provide accommodations if patients know about their living situation, if they live alone, if they live with family members, depends on the age of the patient. So it's important to make sure that we know the baseline, that we know also how bad is their vision, their home life, their daily activities of lifestyle, their challenges, and then make a plan so they are safe at home with providing good lighting, scheduling follow-up, maybe get in touch with their support system, wife, sister, and make them aware of the situations that maybe driving won't be the best option by themselves. Educating about their options like surgery or laser treatment, the post-care about that, how many days it will take, how to make sure they know about signs of infection, medication regimen. So that's about all the things as nurses that we can help our patients that have visual issues. Thank you.